During a stroke, there is a very narrow window of opportunity to intervene and to make a difference in outcomes beyond everything else we do. That window is only several hours long. So it's crucial for patients to be able to recognize the symptoms of stroke and to call 911 to come to medical attention as quickly as possible.
Stroke is a time-sensitive disease. The slogan we say is time is brain. So every minute matters. So the earlier you give TPA, studies show the better the patient's outcome. TPA is tissue plasminogen activator. It's something we all make. It's a protein released by our blood vessels in small amounts. And in stroke, we just give that same protein, which has been genetically engineered by a company called Genentech, and we infuse that in the vein. So we give really large doses of this natural protein. We have a door-to-needle time of requirement of less than 60 minutes, which we're meeting the majority of the time now here, which means from the time the patient hits the ED door, they get the TPA infusing, in the vein in 60 minutes. That's actually hard because you have to get a brain scan, you have to get blood work, you have to talk to the patient. But that's the goal that we aspire to, and now we're meeting that the majority of the time.
After the immediate stroke period is over, there's a longer period of rehabilitation during which patients improve. The rate of improvement varies from patient to patient and from a deficit to deficit. And the ability to improve and to cope with deficits can be enhanced by the rehabilitation experts.
Most of my focus is on taking care of stroke patients. And stroke typically occurs very suddenly and without warning. It can often be a life-changing event for that patient and family. So in the acute setting, we try to do everything we can to reverse the damage from the stroke. Once we get beyond that, we try to determine as best we can what caused the stroke so that we can limit the likelihood of a recurrence. We initiate, obviously, a program of rehabilitation as soon as possible within the hospital to get them on a plan, to get back as much as they can of their functionality and hopefully independence. We define a medication regimen that we think they'll be able to take that's reasonable and that they can afford. After they leave the hospital, we make sure we contact all patients and families within 48 hours to make sure, double check that they understood what they're supposed to be taking as far as their medication regimen, that all their post-hospital care follow-ups are set, and that they can come back and we can continue to manage them long-term as best as possible.